Hi you guys, I have probably one of the most helpful videos I've ever created coming right now to you. So at least I'm hoping it's going to be helpful for you. It is actually a quiz. So grab a pencil or pen and a piece of paper and get ready to write down some answers. Now, what this all came from and was inspired by was the fact that several people were asking me, how do I know if I should be working on strengthening my pelvic floor or relaxing my pelvic floor? I have X condition, I have Y condition, and I don't know if I should work on amping things up or toning things down. Also, some of my colleagues in the world of pelvic floor physical therapy and I were talking about the common condition of people coming to their clinics thinking that they needed to strengthen because they have issues like incontinence or prolapse. And instead, what actually needed to happen before the strengthening began was some relaxing and releasing. So we're going to get started with some quizzes. Now, I want you to understand and make this really clear that for many women, a balance of both strengthening and relaxing is really, really important when it comes to pelvic floor fitness. But again, what these quizzes are going to help identify is, first of all, whether you have some very common women's health conditions, prolapse and incontinence. And secondly, if you are a person who really should focus more on the release before you get to that balanced practice of strengthening and relaxation. I have several releasing videos that are really classified as relaxing, releasing videos. So if you find after doing these quizzes that you actually really should focus on relaxing before you can work on that balanced contracting and releasing, that coordination training, then I will direct you to a playlist. I'll go ahead and put the playlist of pelvic floor relaxing and releasing videos in the notes below this in the video description. So look for that playlist. If you find that you're doing okay, you don't need to just focus on the releasing, you're fairly balanced in the pelvic floor, you don't have any warning signs that show that you really should focus on releasing first, then you're totally safe to begin my more strengthening focused fitness videos and videos such as Ab Camp, which is coming up June 30th and it runs through July 18th of 2017. And if you're watching this in the future, then the Ab Camp videos will be archived. So again, if you find that you, after doing these quizzes, are someone who really needs to focus more on relaxing and releasing, then check the video notes below for a playlist that's really probably going to be best for you. If you find that you're more balanced and you feel like you're okay and good to go, then you are great for Ab Camp or really for any of the videos that are on my YouTube channel. So grab your pen, grab your paper. We are going to start with a prolapse self-identification quiz. First of all, we'll discover if you have prolapse. Second of all, we will discover if you need to work on relaxing or if you can go ahead and go into the more strengthening and coordination training. Now, if you're more interested in incontinence issues, then I'd like you to go ahead and fast forward to the timestamp that I'm going to go ahead and put in above. I'm going to write it somewhere. So fast forward to that point, and that's where I will begin the incontinence self-identification quiz. Now, in both cases, if you're not so into this watching a whole video and fast forwarding and all of that stuff, then you can simply go to the URL that I'm going to write above, and it's kind of long and weird, so I'm also going to list it in the video notes below, and you can go ahead and grab yourself a downloadable copy of these quizzes simply for joining my mailing list. So all you have to do is join my mailing list and check the little box that says pelvic health self-help and it talks about the quizzes. Just check that box and you will be emailed these quizzes to your inbox for free. So let's go ahead and begin. I don't think there's anything else I have to say except a very important medical disclaimer, which is that this is not to be used as a substitute for individualized professional medical diagnosis and treatment. So please do not delay medical treatment or advice from a physiotherapist or a gynecologist or a urologist or anybody like that because of this information. This is really just a starting place. It's really just for education and information. It's general knowledge. And you really should be seeing a healthcare provider in your area in conjunction with doing these self-help quizzes. This is just a starting point. So I want to make that super, super clear. Do not delay in seeking medical advice. So let's go ahead and get started with the Prolapse self-identification quiz. And again, if you're more interested in incontinence, then fast forward to the time that I have written above. All right, let's go. So while you're grabbing your pen and paper, I want to take just a minute to give a shout out to Dr. Susie Gronsky, PT, who has been really, really helpful and really helped collaborate with me to make these quizzes a reality. So thank you, Susie, and let's go ahead and get started with the quizzes. All right, I'm going to essentially be reading from the quiz that you can also get a downloadable version of at the link that I posted below, and it's also in the video notes. So bear with me here. I'm just going to be reading from it. I don't want you to miss a thing. So let's get started with the Prolapse self-identification quiz. So please note first, if you are having symptoms, please see a women's health physical therapist or pelvic floor physical therapist, so he or she can examine you and determine your specific needs. This quiz, again, is for general educational purposes and information only and is not to be considered a substitute or replacement for professional medical advice. Think of this as a starting place and a way for you to begin self-treatment at home while you're waiting for your first physical therapy appointment. First, it's important to identify red flags that would require you to seek medical attention immediately. Answer the following. Do you have severe low back or pelvic pain related to your prolapse? Do you have any numbness or tingling in the pelvic area? Is your prolapse protruding outside of your vaginal opening when you are at rest? For example, when you're not bearing down. If you answered yes to any of these red flag questions, then please seek medical treatment right away. If not, move on. Do you have prolapse? Take the following short quiz and find out. So mark A for yes and B for no. First question, do you feel like something is bulging out of your vagina when you're lifting objects or coughing hard? Mark A or B. Do you feel a sense of heaviness or pressure in your vaginal or anal areas? Mark A or B. Do you see a slight bulge that moves downward toward your vaginal opening when you gently bear down? To test this, you can sit on a toilet seat, separate your labia, and look with a handheld mirror. So mark A or B. Do you have low back or pelvic pain that's less bothersome in the morning and worsens as the day goes on? A or B. Do you feel as if you're sitting on a small ball or as if something is falling out of your vagina? A or B. Do you have difficulty keeping in a tampon? For example, does it fall out after insertion? Mark A or B. Do you have sexual concerns such as the sensation of looseness in the tone of your vaginal tissues or a feeling like something is in the way during sex? Mark A or B. So if you marked mostly A's, then it's likely that you have some form of pelvic organ prolapse. So definitely talk to your healthcare provider to be sure. Again, this is just a starting place, so talk to somebody to be sure. Let's go ahead and move on to the next step, which is identifying if your pelvic floor muscles may be overly active or underactive. So prolapse is an issue usually related to poor support from the connective tissues above and or lack of support from the pelvic floor muscles below. However, for people with overly active pelvic floor muscles, pelvic floor relaxation and coordination must be addressed before strength and endurance can be improved. So we're going to find out, is your pelvic floor overly tense or is it underactive? Do you need to work first on relaxation or can you go straight to strengthening exercises? So take the following short quiz and find out. Again, we're going to do A is yes and B is no. So just write down A or B for all of the following questions. So number 1, do your pelvic floor muscles, and think of your vaginal and your anal area muscles, do they feel achy or tense by the end of the day? So mark A or B. Mark A or B for all of the following. Number 2, are you unable to relax or release after a Kegel contraction? And just FYI, a Kegel is when you squeeze and lift your pelvic floor muscles, which are the muscles that we're just talking about, the vaginal and anal area muscles, and then you release. That's a Kegel. Number 3, do Kegels make your prolapse feel worse? Number 4, do you have a history of pelvic region injury or trauma? For example, a fall on your tailbone or a very difficult labor and delivery. Number 5, do you have a history of sexual abuse or other forms of emotional or physical abuse or trauma? 6, is it difficult to empty your bladder? 7, does your urine stream start and stop? 8, is your urine stream very strong and or does it spray? 9, do you suffer from constipation and or retain stool? 10, do you need to use your fingers to help eliminate stool from the rectum? 11, is it difficult or painful to insert a tampon? 12, if you're sexually active, is intercourse uncomfortable? 13, are gynecological exams uncomfortable? 14, do you feel embarrassed, uncomfortable, or squeamish thinking about, talking about, or examining yourself down there? All right, so go ahead and gather up your answers, see how many times you marked A and how many times you marked B. And if you marked mostly A's, then you might have a hyperactive or hypertonic pelvic floor. This indicates that you must first work on releasing and relaxing your pelvic floor muscles so that you can successfully strengthen them later after you've learned how to let go. This can be hard for people with prolapse. You don't want to let go for fear that everything will fall further, but please understand that the release is an essential step on your journey toward reversing your symptoms or preventing progression. If you have a tense pelvic floor, then I encourage you to take several rest breaks throughout the day. Lie down on your back with your hips propped up on pillows in a supported bridge position. This helps move your pelvic organs back into place and will decrease downward pressure on your pelvic floor muscles. I also recommend that you spend time releasing the pelvic floor by way of my pelvic release videos, the reverse Kegel exercise, and deep breathing. And again, check the playlist that I have linked in the notes below this video. If you marked mostly B's, then you might have a weak, underactive, or uncoordinated pelvic floor. Focused pelvic floor exercises such as Kegels will likely be helpful for you as long as you're doing them correctly. And by that, I mean contracting and then fully relaxing the pelvic floor muscles. Unfortunately, many women tend to Valsalva, bear down, or use accessory muscles to substitute for pelvic floor muscle contraction during Kegel exercises. They have no awareness of what's going on down there. This is one good reason it's important to seek advice and feedback from a pelvic floor physical therapist. Individual guidance will go a long way toward improving your condition. Please note that in addition to Kegel exercises, you must also do other core strengthening exercises such as hip, gluteal, abdominal, and back exercises coupled with daily low-impact cardiovascular activity. So if you marked a mixture of A's and B's, so kind of half and half, then you have some things going on that relate to a weak pelvic floor and others that go hand in hand with a hypertonic pelvic floor. Continue to educate yourself about the pelvic floor and pelvic health and focus on exercises that improve body awareness and control. Relaxation techniques such as the reverse Kegel can help, and watch my video called Front versus Back Kegels plus What Does the Pelvic Floor Look Like, and I will link these in the video notes below. Remember, it is important to see a medical professional such as a pelvic floor physical therapist to determine your individualized needs, but hopefully this quiz gave you a starting place for self-care that you can begin at home. So that is our prolapse self-identification quiz, and let's go ahead and move on to the incontinence self-identification quiz. All right, so let's get started with the incontinence self-identification quiz. Remember, if you're having symptoms, please see a women's health physical therapist or pelvic floor physical therapist so he or she can examine you and determine your specific needs. This quiz is for general educational purposes and information only and is not to be considered a substitute or replacement for professional medical advice. Think of this quiz as a starting place and a way for you to begin self-treatment at home while you're waiting for your first physical therapy appointment. First, it's important to identify red flags that would require you to seek medical attention immediately. Answer the following. Did your incontinence symptoms begin rapidly and out of the blue? Number 2, since your incontinence problems began, do you have pain, numbness, or tingling in your low back, pelvic area, or down one or both of your legs? Have you noticed weakness, sensory deficits, or reduced or absent reflexes in your lower extremities? Have you had any problems with walking or loss of balance since your problems began? If you answered yes to any of these red flag questions, then please seek medical attention immediately. If not, move on. So let's go on to the self-identification quiz. So grab a pencil and get ready. So what we're answering in this part of the quiz is, do you have incontinence? Take the following short quiz and find out. So if your answers are yes, mark A. If your answer is no, mark B. Number 1, do you leak urine even just a little when you cough, laugh, sneeze, lift, jump, transition between movements, etc.? A is yes, B is no. Number 2, do you leak urine even just a little during exercise classes, workouts, running, or walking? Number 3, do you leak urine even just a little when you're pulling down your pants and undergarments to use the toilet? Number 4, when you feel the sensation to urinate, do you have to rush to use the toilet? If so, do you ever not make it in time? Number 5, do you find yourself using the toilet just in case before every car ride or trip out of the home or office? Number 6, do you know where every public restroom is located in every public facility that you frequent, for example, the grocery store, shopping mall, etc.? Next question, do you have a hard time holding in gas, flatulence? And last question, have you ever experienced leakage of stool, fecal matter? If you marked mostly A's, then it's likely that you have some form of incontinence. And different forms of incontinence include stress incontinence, urge incontinence, and mixed incontinence, as well as fecal or bowel incontinence. Talk to your healthcare provider for the appropriate diagnosis for you. Now, let's move on to the next step, which is identifying if your pelvic floor muscles are overly active versus underactive. Different forms of incontinence have different underlying causes. One common cause is lack of support, coordination, and control of the pelvic floor muscles. However, for people with overly active pelvic floor muscles, pelvic floor relaxation must be addressed before strength and coordination can be improved. Is your pelvic floor overly tense or underactive? Do you need to first work on relaxation, or can you go straight to the strengthening exercises? Take the following short quiz and find out. So just like before, for your answers that are yes, mark A. For your answers that are B, mark no. So our first question, do you often hover over the toilet seat when urinating? And by that, I mean the position where you're hovering above the toilet seat. You're not actually sitting all the way down on the toilet. You're up above the toilet seat and you're hovering. So mark A or B for that. A is yes, B is no. Next question, do you leak urine when you have a sudden and strong sensation to urinate? Is it difficult to empty your bladder? Does your urine stream start or stop intermittently? Next, is your urine stream very strong and or does it spray? Do you suffer from constipation and or retained stool? Do your pelvic floor muscles, vaginal and anal area muscles, ever feel achy and or tense? Are you unable to relax or release after a Kegel contraction? And just to be super clear, a Kegel contraction is when you squeeze and lift your pelvic floor muscles, the vaginal and anal area muscles squeeze and lift, and then you fully release. So again, the question is, are you unable to relax or release after a Kegel contraction? A is yes, B is no. Next question, do Kegels make your incontinence or bladder issues feel worse? Next, do core exercises, for example, Pilates or ab-focused fitness classes, make your incontinence or bladder issues feel worse? Do you have a history of pelvic region injury or trauma, for example, a fall on your tailbone or a very difficult labor and delivery? Do you have a history of sexual abuse or other forms of emotional or physical abuse or trauma? Next question, if you're sexually active, is intercourse painful or uncomfortable for you? The next question is for men. If you're a male, do you have sexual difficulties such as difficulty ejaculating or difficulty with erections? Next question, are gynecological exams uncomfortable? Is it difficult to insert a tampon? Do you have difficulty keeping a tampon in place? For example, it moves position or falls out after you've put it in. And finally, do you feel embarrassed, uncomfortable, or squeamish thinking about, talking about, or examining yourself down there? So if you marked mostly A's, then you might have a hyperactive or hypertonic pelvic floor. This indicates that you must work first on releasing and relaxing the pelvic floor muscles so that you can successfully strengthen them later after you've learned how to let go. This can be hard for people with incontinence. You don't want to let go for fear that you'll leak more, but please understand that the release is an essential step on your journey toward reversing your symptoms or preventing progression. If you have a tense pelvic floor, then I encourage you to learn how to release the pelvic floor by way of my pelvic release videos, the reverse Kegel exercise, and deep breathing breaks. And again, I will link to a playlist that's great for you in the video notes. Also, if you hover above the toilet seat when urinating, and that was the very first question in this second part of the incontinence quiz, then stop hovering, sit down to pee. And I have a video called Toilet Tips that I think will be really helpful for you. So I'm gonna link that in the video notes below as well. Look for the video that is titled Toilet Tips. If you marked mostly B's, then you might have a weak, underactive, or uncoordinated pelvic floor. Focused pelvic floor exercises such as Kegels will likely be helpful for you as long as you're doing them correctly, which means contracting and then fully relaxing the pelvic floor muscles. Unfortunately, many women tend to Valsalva, bear down, or use accessory muscles to substitute for pelvic floor muscle contraction during Kegel exercises. They have no awareness of what's going on down there. This is one reason it's good to seek advice and feedback from a pelvic floor physical therapist. Individual guidance can go a long way toward improving your condition. Please note that in addition to Kegel exercises, you must also do other core strengthening exercises such as hip, gluteal, abdominal, and back exercises, coupled with daily low-impact cardiovascular activity. If you marked a mixture of A's and B's, then you have some things going on that relate to a weak pelvic floor and others that go hand in hand with a hypertonic pelvic floor. Continue to educate yourself about the pelvic floor and pelvic health, and focus on exercises that improve body awareness and control. Relaxation techniques such as the reverse Kegel can help, and go ahead and watch the video that I will link to in the notes below, which is titled Front versus Back Kegels, plus What Does the Pelvic Floor Look Like? Remember, it's important to see a medical professional, such as a pelvic floor physical therapist, to determine your individualized needs, but hopefully this quiz gave you a starting place for self-care that you can begin at home. So thank you so much for watching. I hope this video was helpful and these quizzes were helpful. Remember, again, that this is just for information and general education only. It's not a medical diagnosis or treatment that I'm giving you right now. So please talk to your healthcare provider if you have questions based on your needs. And remember to check the video links in the notes below this video for direct hyperlinks to where you're going so you don't have to type in any crazy URLs. So thank you for watching, and I will see you next time. As always, remember, eat clean, move every day, and you will shine brighter.